Many people who are over 50 years old have stiffness and cramps in their legs, especially in the morning. This is not normal. And today we're going to talk about what causes this problem and what you can do about it. I've recreated this video series to help answer some of your medical questions and the questions that I get from patients each and every day. Well, there's several reasons. First one is poor circulation. Poor circulation means that your muscles don't get enough blood flow. The blood flow brings oxygen and nutrients to your muscles so they can function properly. If they don't get enough blood flow, they start to waste away and atrophy and also cramp up. So if you're suffering from these cramps and stiffness, what can you do about it? Aerobic exercise like walking can help increase circulation to your legs. If your doctor determines that you have vascular disease like peripheral artery disease, then he or she might recommend medications like aspirin or other antiplatelet medications to help prevent clots from forming and blocking the blood flow to your legs. In more severe cases, your doctor may recommend angioplasty and stenting, or even surgery to bypass the blockage in the arteries that supply blood flow to your legs. Soaking your feet in warm water can help promote circulation and reduce swelling. Just make sure that the water is not too hot and always test the temperature on your wrist first before putting your hands or your feet in it. After you soak your feet, put on some lotion and massage them to reduce swelling. Another thing your doctor may recommend is wearing compression stockings. Antioxidants help reduce inflammation and oxidative stress in your body. Alcohol can also contribute to poor circulation and dehydration, so it's best to avoid it altogether. Acupuncture is a form of alternative medicine that involves inserting thin needles into specific points on the body. Some people say that acupuncture has helped them relieve pain and improve circulation. So it may be worth trying if you're suffering from these symptoms. Oxidative stress is a type of cell damage that can occur when you re-expose to environmental toxins or when you have chronic medical conditions. I want to thank you all for watching. This is Dr. Anonymous, and I'll see you next time. So by eating foods that are high in antioxidants, you can help protect your body from this type of cell damage. Some examples of foods that are high in antioxidants include berries, dark chocolate, nuts, and green leafy vegetables. Applying heat to your legs can help promote circulation and relax your muscles. Be careful though, and never apply heat to bare skin. Always put a towel or a blanket between the heat source and your skin to prevent burns. Compression stockings apply pressure to your legs and help promote circulation, pushing the blood upwards towards your heart. So if your legs are swollen and inflamed, you can apply a cold compress. It's important to stay hydrated, especially if you're older or have chronic medical conditions. So make sure you drink plenty of fluids throughout the day. How much is plenty? Well, for most adults, it's about 2 liters or 8 cups of water per day. But you may need more or less depending on your activity level and the climate you live in. To do this, grab some ice cubes and wrap them in a towel or put them in a plastic bag and apply them to your legs for 20 minutes at a time. You can also use a cold pack from your freezer. Remember to always protect your skin from direct contact with ice. Your doctor may also recommend medications like silostazol or pentoxifylline, which help improve circulation to your legs and reduce the cramping and stiffness. First off, make sure you see your doctor and rule out any serious underlying problems. Make sure you get your blood pressure checked, your blood sugar checked, and a basic metabolic panel and a lipid panel to check your cholesterol levels. All of these things will give us clues as to what's causing these cramps and stiffness. If you find this video helpful, please do me a favor and subscribe. I'm a doctor. I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. Vascular disease like peripheral artery disease, which is a narrowing of those arteries that supply blood flow to your legs, can cause cramping, stiffness, and pain in your legs when you walk. This is called claudication. Claudication is a medical term for this cramping, stiffness and pain that happens when you walk because of poor circulation. Stretching your calf muscles can help improve circulation and reduce cramping. To stretch your calf muscles, stand up and lean against something that's sturdy. Slowly raise one leg up while keeping the knee straight. Hold for 30 seconds and then switch legs. You can also try stretching your hamstrings by standing up and reaching down towards your toes. Hold for 30 seconds and then switch legs. Now, why do people over 50 years old tend to get these leg cramps and stiffness? Another reason why you may be getting these cramps is because of nerve impingement. Nerves can become pinched or compressed by bone spurs, which is a sign of arthritis, or a bulging or a herniated disc in your lower back. So when the nerves that go down into your legs become impinged, you can feel that as pain, cramping, or stiffness in your lower extremities. The next reason is vascular disease. The last reason is because of low albumin levels. Albumin is a protein that stays in your body and helps maintain the fluid balance between the inside and the outside of your cells. When you have low levels of albumin, fluid builds up in your tissues. That fluid that builds up in your tissues puts pressure on your nerves. And guess where those nerves are? They're in your muscles. Your inner muscles, by the extra fluid, can cause cramping and stiffness in your legs. So now let's talk about how to fix this problem, right? If your doctor determines that you have poor circulation, then he or she might recommend a few things. One is regular aerobic exercise. If your doctor determines that you have nerve impingement, then he or she might recommend physical therapy or, in severe cases, an anti-seizure medication or an antidepressant medication to help reduce the nerve pain. And if your doctor determines that you have low albumin levels, then he or she might recommend eating more protein, reducing your alcohol intake, and getting more exercise. The next thing that you can do at home is stretch your calf muscles. The next thing that you can do at home is to soak your feet in warm water. You can also use a heating pad or a hot water bottle to apply heat to your legs. Another thing you can do is to apply a cold compress to your legs. Applying cold can help reduce swelling and inflammation. Another thing you can do is drink more water. Drinking more water can help thin your blood and improve circulation. You can also eat foods that are high in antioxidants. Next, avoid smoking and limit your alcohol intake. Smoking restricts your blood vessels and reduces circulation, so it can make cramps and stiffness worse. Finally, you can try acupuncture. Well, I hope this video was helpful. If you enjoyed my content, please take a second to subscribe.